Assalamualaikum. In this video lecture, I will deliver the neuronal tumors. Previously, I have 5 to 6 videos on the glial tumors, right? So the neuronal tumors, far less common than the glial tumors, still remain in the market. So they love to occur in the younger adults, unlike glial tumors. These tumors exhibit the neuronal differentiation. Obviously, this is the reason we call them the neuronal tumors. And focal neurologic complaint is always present, that is often seizures. कोई भी पेशेंट बेटा उसको न्यूरोनल ट्यूमर है तो जो मेन कंप्लेन उसको हमेशा परसिस्ट करती है जब तक वो ट्यूमर है, तो दैट इज़ द सीजर्स. ठीक है, डिफरेंट न्यूरोनल ट्यूमर्स हैं, ये बहुत कम है कंपेयर टू ग्लाइल ट्यूमर. ग्लाइल ट्यूमर्स की तो बहुत ज़्यादा लंबी लिस्ट थी, लेकिन यहाँ पे बहुत कम है न्यूरोनल ट्यूमर्स. नंबर 1, Gangliogliomas, right? It's the most common neuronal tumor of the CNS. Most common neuronal tumor of the CNS. It is composed of, now interesting thing is going to be there. It is composed of the mature neuronal cells, so it's good, but you will be very much like it's something very new to know that gangliogliomas composed not only of the mature neuronal cells, but it also contains the glial cells as well. So there is a mixture of the mature neuronal cells and few glial cells as well. What about the course of the ganglioglioma? क्या इसका इख्तिताम हो सकता है? स्लोली ग्रोइंग ट्यूमर, ठीक है, लेकिन जो इस ट्यूमर के अंदर ग्लायल कंपोनेंट मौजूद होता है वो ओकेशनली एनाप्लास्टिक हो जाता है. और अगर वो एनाप्लास्टिक हो जाए, यानी कि उसके अंदर माइटोटिक एक्टिविटी बढ़ जाए, न्यूक्लियर साइटोप्लाज्मिक रेशियो अल्टर हो जाए, क्रोमेटिन मटेरियल काफ़ी डेंस हो जाए, तो फिर ये ट्यूमर काफ़ी रैपिडली प्रोग्रेस करता है. अभी तक क्या बात हुई बेटा? व्हाट इज नेम द मोस्ट कॉमन न्यूरोनल ट्यूमर of the CNS? It is ganglioglioma, composed not only of the neuronal cells but also the glial cells, right? It's, by the way, a slowly growing tumor, but this bad boy present in this tumor, glial cells, sometimes, occasionally, I mean to say, they become anaplastic. In this case, the tumor grows very rapidly. What about the treatment option to get rid of ganglioglioma? Surgical resection of the tumor. It is very effective in controlling the seizure. Patient coming to you with the ganglioglioma, lots of seizures to the patient. You just surgically resect this tumor, patient will get rid of the seizures, right? What is the underlying mutation behind this ganglioglioma? In 90% cases, there is a gain of function mutation in the proto-oncogene, that is the BRAF gene V600E. But if you don't even keep this in your mind, you just keep in mind there is a proto-oncogene called BRAF gene. इसकी एक्टिवेटिंग म्यूटेशन हो जाती है, ये जीन जो है एक्टिवेट हो जाता है और इसकी ओवर एक्टिवेशन की वजह से you develop this ganglioglioma. Where exactly in the brain? Most common site is the temporal lobe. If we talk about the morphology of this tumor, grossly this tumor is very much solid cystic appearance इसकी होती है काफ़ी. इसकी बेसिस में पिक्चर भी नहीं होना, मैं दिखा देता ज़रूर. Solid cystic tumor under microscopy. Obviously, under microscope you will see the tumor cells. The tumor cells are the ganglion cells. I mean the neuronal cells. The cells are very much, irregularly clustered with the random orientation of the neurites. So just let me make the morphology clear. I don't know why most of the students say this part is difficult. The morphology of ganglioglioma. ग्रॉसली ये ट्यूमर कैसा दिखता है बच्चों? ये ग्रॉसली ये ट्यूमर जो है कैसा होता है? काफ़ी सॉलिड होता है, काफ़ी सिस्टिक होता है, ठीक है. अगर आप इस ट्यूमर को अंडर माइक्रोस्कोप देखो तो इसके जो सेल्स होते हैं दो तरह के होंगे, जैसे मैंने बताया, न्यूरोनल सेल्स और ग्लायल सेल्स. जो न्यूरोनल सेल्स होते हैं या फिर गैंग्लियन सेल्स, दे आर वेरी इरेगुलरली क्लस्टर्ड. और न्यूरॉन है तो फिर इसके न्यूराइट्स भी होंगे, डेंड्राइट्स और एक्सोनल प्रोसेसेस, ठीक है, उसकी भी काफ़ी रैंडम ओरिएंटेशन होगी. और जो ग्लायल सेल्स हैं what do you think, what type of glial cell it is going to be? Lots of glial cells are there, astrocytes, oligodendrocytes, ependymal cells. So they are, in this case, glial cells are here, they resemble low grade astrocytoma, which are lacking the mitotic activity and necrosis. So let me take you back where I was there. Yeah, here I was. So I told you under microscope, two cells are there. One the neuronal cell, that are the ganglion cells, and the glial cells. And your neuronal cells, they are irregularly clustered, and the neurites of these cells, that are the dendrites and the axons, they are having random orientation. The glial component, it includes लो ग्रेड एस्ट्रोसाइटोमा, लो ग्रेड तो माइटोटिक एक्टिविटी कम होगी और नेक्रोसिस भी नहीं होगी. ठीक है जी. तो ये हो गया आपका गैंग्लियोग्लायोमा, राइट. And then at number 2 comes another neuronal tumor, and that is dysembryonic neuroepithelial tumor. Really interesting. It's a rare. Obviously, all the neuronal tumors compared to glial, they are not that much common. Well, this dysembryoplastic neuroepithelial tumor, it is a low grade tumor, and which is obviously considered as the WHO grade 1 tumor. खास करके बच्चों में होता है. मोस्ट कॉमन प्रेजेंटेशन न्यूरोनल ट्यूमर चाहे कोई भी हो उसकी सीजर्स के साथ पेशेंट आता है. ठीक है. इट हैज़ गुड प्रोग्नोसिस. After the surgical resection, you resect this tumor with the help of surgery. Later you will have very good prognosis, right? What about the site from where it appears? Superficial temporal lobe, just like the ganglioglioma. But the problem is, if this, let's suppose this is the temporal lobe, if this is the temporal lobe of the brain and the overlying skull is here, so if this is the skull, ये आपकी बोन आ गई, फर्ज करें नीचे टेम्पोरल लोब है. टेम्पोरल लोब का ट्यूमर है ना बेटा, इसका इफेक्ट इस ऊपर वाली स्कल बोन पे भी होता है, वीकनिंग ऑफ दिस अवरलाइंग स्कल बोन. ठीक है. which is suggesting that the tumor is present for the long time. So if this is the brain and this is the temporal part of the brain, here you developed the tumor, and this tumor keep on digging onto the surface of the this skull bone, and there is some damage, there is weakening of this area of the bone produced, suggesting that the tumor was present for a long period of time. Right, beta. So that was, yeah, easy, I think. Not that difficult. Just quickly have a look at the morphology part of the dysembryoplastic neuroepithelial tumor. Grossly, it is more like the nodules, intracortical nodules, right? Grossly, intracortical nodules. ठीक है जी. Present inside the cortex, cerebral cortex, and under microscope, if you look into this tumor, the tumor cells, let me tell you, the tumor cells under the microscope, they are very small, round, and they are arranged in the columns, and the myxoid material is deposited in the background. If you are good in histopathology, you will understand without I explain this, but still I have to tell you that what does it mean. That the background is myxoid, that the myxoid material is deposited, lots of myxoid material, और इस पे जो है you will come to find the tumor cells. The tumor cells are small, they are round, they are arranged in the columns. They are small, they are round. Okay. And there is, especially the neurons are more like, can you see, if you notice and you focus onto this presentation, you will see the background is like, okay, as I mentioned, it's a myxoid background. So it's a myxoid background, so it's actually the myxoid material जो कि पीछे मौजूद है. ये एक वाटर का काम कर रहा है, जैसे कि ना पानी हो, और पानी के ऊपर ये आपके जो ट्यूमर सेल्स हैं, न्यूरॉन्स हैं, वो तैर रहे हों. तो ये जो ट्यूमर सेल्स है वो तो है तो न्यूरोनल ट्यूमर है ना, तो जाहिर सी बात है न्यूरॉन्स होंगे, तो दे आर सेड टू बी द फ्लोटिंग न्यूरॉन्स. फ्लोटिंग न्यूरॉन, जस्ट लाइक the neurons are actually floating on this myxoid material, myxoid background. So therefore I have written here that these are the floating neurons. These are the tumor cells. न्यूरोनल ट्यूमर है तो जो ट्यूमर सेल्स होंगे तो वो न्यूरॉन्स ही होंगे ना. And because they are floating on the myxoid background, they are floating on the myxoid background, they are said to be the floating neurons. Look, they are sit in the pool of the mucopolysaccharide rich fluid of the myxoid background. I hope it is clear to you, beta. There is nothing difficult in this. So microscope is really interesting. ग्रॉसली बाहर से आप नेकेड आई से देखोगे तो नॉड्यूल्स नजर आएंगे, अंदर माइक्रोस्कोपिक स्टडी करोगे तो ट्यूमर सेल्स देखोगे, दे आर मोर लाइक द फ्लोटिंग न्यूरॉन्स. दे आर फ्लोटिंग इन दिस नाइस लिटिल बेड ऑफ वाटर, नॉट द बेड ऑफ वाटर, सॉरी, bed of myxoid material with lots of mucopolysaccharide. Comes the last neuronal tumor, and it is central neurocytoma. It is not high grade, it is low grade, grade 2 neuronal neoplasm within the ventricular system. Interesting. I mean, the previous two were loving to grow in the temporal lobe, in the cortices of the cerebrum particularly, but here this central neurocytoma is growing into, growing from the ventricular system, especially the lateral or the third ventricle, characterized by the evenly spaced round uniform nuclei and often islands of the neuropils. So actually there is nothing but the tumor cells are evenly spaced, and their nuclei are very much round and uniform, and in between there are the island of the neuropil. Neuropils refer to dendrites and the axonal processes. So obviously this is a neuronal tumor, so there will be lots of the tumor cells, lots of the neurons actually, right, with lots of dendrites and axonal processes. And this tumor actually resembles the oligodendroglioma, which we previously discussed in the glial tumors. This is all about beta the neuronal tumors, nothing else. Okay, after the glial and the neuronal tumors, few more varieties we have to discuss, keep on discussing. And now comes the poorly differentiated neoplasms. After the neuronal tumors comes the poorly differentiated neoplasms.